Hello, and thank you for watching this video. My name is Robin Holmes-Sullivan, and I serve as the Vice President for Student Life and Dean of Students at Lewis & Clark. That means I have primary responsibility for the issues and opportunities that occur for students outside the classroom, as well as oversight over many of the programs and services that students need and use every day. I also serve on the President's Executive Council and have responsibility for the policies and procedures that assist students while they are a part of the Lewis & Clark community. I want to first say congratulations to students who are watching for your accomplishment of being admitted to Lewis & Clark. Bravo! We can't wait to have you on campus. And to your parents, I can assure you, your student made the right decision to attend Lewis & Clark. Now, what is on everyone's mind is, are we going to have face-to-face classes in the fall? We are definitely planning for that. All indications from Oregon's governor, a Lewis & Clark Law alumna, is that we will be in phase 2 of the state's reopening plan sometime in mid-July or early August. Phase 2 is a signal that in-person classes can commence, so that's the moment we're waiting for. Our governor has taken a very measured, safety-first approach, and it has paid off. Oregon has had a manageable outbreak, our hospitals are not overrun, and we have been able to flatten the curve very well. We also acted very quickly at Lewis & Clark, and within days of the outbreak, we mobilized and made sure that we could safely get our students and staff off campus and transition to online learning and telecommuting. To this day, we have not had an active case of COVID-19 on our campus. We were prepared just in case. In addition to quickly densifying the campus and helping students get home, we set aside residence hall rooms for isolation and self-quarantine for any student who had symptoms or had been exposed. Our health center conducted testing on campus so we could rapidly gain knowledge about any possible cases and help students to stay safe. We developed an isolation and symptom reporting policy and procedure to help us track who might be symptomatic and to make sure they were receiving medical attention and isolating them safely away from the community for the required amount of time to contain any transmission. Our efforts paid off, and we learned a lot in the process. Many of these procedures will be in place for the fall, but even more are being developed. Since that initial emergency time when we were rapidly responding to the crisis, things have really slowed down on campus. Only about 50 students remain in the residence halls, and for the most part, everyone is working from home. We are now in the active planning for reopening. Our president, Vim Vival, and his team have launched an LC reopening plan that operates from these 4 principles. First, our primary focus is the health and safety of our students, staff, and faculty. Second, we are committed to preserving the quality of the student experience. Third, we will develop approaches that maintain the financial viability of Lewis & Clark. And finally, we will develop approaches that protect the institution's reputation and values. Like all the other vice presidents and deans, I am creating a unit-specific plan that will be presented and approved by the President's Executive Council. We will also present an overall reopening plan to the governor's office. President Vival has been quite active in providing leadership and influence on behalf of Oregon's independent colleges on the governor's various task forces, and he's a key member of the task force on higher education in our state. Some of my responsibility will be in planning and making recommendations regarding residential living, dining, health and wellness, athletics, campus safety, developing public health campaigns that will help shape positive public health practices, student safety, and creating ways to ensure students can safely engage in social and out-of-the-classroom activities. There is lots to do. I'm fortunate to have a very professional team that is hard at work developing recommendations and procedures that will keep our students safe. We have registered nurses, nurse practitioners, doctors, public health professionals, psychologists, and counselors right here on campus who are ready and capable of providing care to our student body. And of course, education is key. We will make sure that each and every student completes an educational module regarding important public health practices like hand hygiene, physical distancing, proper cough, sneeze etiquette, symptom assessment, proper use of face covering, and much more. We are developing enhanced cleaning and disinfecting protocols, especially in high traffic areas like the residence halls and dining areas. We are pursuing proper symptom tracking and assessment procedures, and are working to secure our own rapid testing machine so that we can quickly and effectively test our LC community when needed. We will limit social gatherings to under 50 people and find ways to allow students to congregate and have fun, but in a healthy, safe manner. And we have isolation rooms set aside so that if a student feels they may have symptoms, they can safely and comfortably be monitored, but also ensured that they are not transmitting the virus to others. These are just some of the many things we are pursuing. There is much more I could talk about, but suffice it to say, we will be ready with robust plans and procedures in place to keep our community safe and our campus running. These are truly unprecedented times we are in, but like with all challenges, the way through it is together. You are joining an amazing community, a community that cares for one another, and we will make it through this together. I can't wait to see you in person on campus in the fall. We're putting the finishing touches on our new student orientation and summer reading for incoming first-year students as we speak. You're gonna love it here. See you soon.